Once you're live, we can start with the introduction. You can start, Ikshita.
Are you with us, Ikshita?
So, thank you everyone for joining in. As Ipshita said, for the live for the YouTube, we'll just quickly request everyone to please be interactive in this session. We have with us Dr. Shyam Rengan, sir, whom Ipshita will introduce for sure. And we request whoever has joined in to make it interactive with their questions so that it helps not only you but also any future aspirant who might be thinking of taking up surgery. So, can we start, Ipshita? Meanwhile, you can work on the live.
Starting off with the session for tonight, this is actually a second session for tonight's Meet the Resident and the third session in total. So, Meet the Residents was a program that was curated by the members of SAMHSA with an intention of telling the PG aspirants of exactly what to expect during their residency and why should somebody maybe pick up a particular branch of a particular specialty for the rest of their lives, because a lot of it a lot of which specialty we get into is what shapes us into, I don't know, maybe clinicians, doctors, specialists in our various fields. So, starting off for tonight, we have Dr. Shyam Rengan with us, and we have Dr. Aayush Bhadani with us. So, just a short introduction for everybody who has joined in. Dr. Rengan has done his MBBS and DNB. So, he's a DNB in general surgery, and he has done that from Sir Gangaram Hospital, Delhi. And Dr. Aayush Bhadani is presently doing his second year of post graduation in general surgery from IMS Patna. So, thank you so much for taking out time for us tonight and helping us out with this particular venture of ours. So, Ayush Bhaiya, thank you so much for introducing us to Dr. Rengan, and thank you, sir, for joining us. So, with this, I would like to hand it over to our specialist. Yeah, please.
Yeah, thank you, Ikshita, for the brief introduction. So we'll start the session.
So, sir, I've thought to elaborate the session into few themes, and we'll discuss on those themes, and we'll discuss few of the topics related to it. So, even for the audience, the first theme which we would like to take up is the very pertinent question that are surgeons born or are surgeons made? So, my first question to you, sir, would be: were you always wanting to be a surgeon? Was it running in your blood, as they always say, or was it something which pushed you towards becoming a surgeon?
Okay, nothing pushed me. So I'll just introduce myself. I'm Shyam Rengan, and my father is also a surgeon. He's Dr. R.S. Rengan, senior consultant in Chennai. My brother is also a surgeon. He is doing pediatric surgery in SMS Jaipur. And they both, I won't tell they forced me, no one forced me to do surgery. They just had a very big influence in my life. Just after 12th standard, I used to assist my dad in basic surgical cases. Then during college, when I used to come home, then he used to give me skin closures. So from that time, I was quite fascinated about surgery. I had my thoughts. So when I was preparing for NEET, I was interested only in surgery at that time. But just after I got the rank, some people told that surgery will be really difficult. You can consider taking other subjects like. I was thinking a little bit maybe radiotherapy, so that your life will be a little bit relaxed. But then I thought you should always take what you really like. I mean, going out of the comfort is totally fine, but doing something which you don't like, that is a real sin. And that is where I decided that I need to take surgery.
So I think very true to the lines. It was almost same for me as well. Definitely, I don't belong to a medical family, but I was deeply influenced by the professors who were there at my college, including someone like Professor Ramanuj Mukherjee sir. So seeing them perform OTs and the caseload and everything, the adrenaline rush which we get in managing emergency cases was something which really pushed me. Plus, I feel good books like Bailey and Love also influenced me to take up surgery. So definitely, I don't think even I was born as a surgeon, but the circumstances made me think and want to take up surgery. Even when I got some good ranks, I was towards delineating towards radiology. That is like, yeah, acha rank, I take up radiology. What's wrong? But even now, as a surgeon, when I go and when I discuss the radiology films with someone, or when I see the patient CTs or MRIs, is when I'm able to not just see the film but also relate it clinically. Okay, so this is the film, this is how the patient is presenting. So okay, this is the diagnosis, and that is not the pause, that is not it, that is not a full stop. Now I'm going to intervene, now I'm going to cure the person of the disease. So I think that really differentiates surgery from any other field, where you are seeing a pathology, where you're treating it right away. And I'll just go to the second theme of the session, sir: surgery as a branch. So just continuing with that, how do you think is surgery different from other branches?
Yeah, it's different from, very different from other branches. As you rightly told, as a radiologist, they don't see patients. It's a very bad thing, as you don't treat the patients directly. Being a surgeon, you can do everything. You can actually be a radiologist, you can interpret CTs. As I think I met Aayush Bhadani in a conference called Deep Impact Hernia Conference. And I think you would have realized that most of the surgeons, they interpret very good CTs of hernia. They are experts in diagnosing radiological films. And also, you also treat, you give medicines, so you become a physician too. So the advantage is that you become an all-rounder and you treat in a whole fashion. That is the main advantage of general surgery. And one more big advantage of surgery is when a patient comes to you with a problem, immediately you treat him. If, for example, if you do have a patient has a cholecystitis, you do lab chole, the next day he goes. That kind of satisfaction you get in surgery, and I'm sure no other field has that much satisfaction. Definitely, maybe oncosurgery, the treatment takes time. Advanced gastrosurgery takes time, but definitely it is quite satisfying. Surgery is.
Definitely, sir. So for someone who's presenting with a hernia, has a huge lump, and we operate, and it just goes in, and you put a mesh, and it looks so beautiful the next day. The patient is like, it's fine, it's done. And there are daycare surgeries now. You operate small lipomas, swellings, which the patient was causing cosmetic problem. And even, sir, when I see other fields like, see, respect to all other branches, but something which sets you apart from taking surgery is that knack to just quickly get over the pathology. We do not take the pathology like, okay, abhi hai, then we'll call them OPD next day. We always try to, theek hai, abhi aaya, let's just get it done. Let's get a viral marker, just operate and get the patient done. So right now, very recently, I was following up the hernias which have been operated, and I was so glad to get the feedback from them, and they were so happy that the swelling is gone, the main complaints are gone. And right now also we are a lot focusing on the patient reported outcomes, not just the surgeon satisfaction. So even that is a lot in terms of surgery compared to, say, someone like medicine, where the person has to take in, say, a pill for continuous days. He has to be very compliant with it. But for surgery, he has to just prepare for one surgery, one good surgery, and it's done. So I think that really sets you apart. So the next question would be, sir, who should take up surgery, or what attributes or what qualities do you feel one should have for you to aspire to be a surgeon?
There's a very important question which everyone should know before taking surgery. First, you should know that you should be confident enough to make decisions. So, if you're not confident enough, don't take surgery. One thing. And your interest should not be just after you study surgery. Studying surgery is totally different from what you practice surgery. Unfortunately, this trend I'm seeing in North India. I did undergraduate from South India, but in North India, many people they don't even attend internship. They don't know what surgery is. They just have that impact. What they see, maybe some marrow videos or preparator videos, and they are inspired by surgical videos. And only the theory they are inspired, and that is and that is where people get disappointed when they join residency. That's totally different. For example, I'm even surprised that many people even don't know suturing, but they're interested in surgery.
Yes.
I'm sure even you would get your juniors, sir, I don't know how to put rice tube, I don't know how to put Foley's, but they have joined surgery and they tell, I'm very interested in surgery. I'll tell you, you're not interested in surgery, or else you would be knowing these basic skills.
Yes, definitely, sir. Even right now, so a lot of juniors who are coming in. Thankfully, we were also from college in Calcutta where we got a lot of hands in internship. But it has been a trend that in internship, even my interns right now would not come up for procedures, and they would be like, "Ki, sir, theek hai na, marrow videos dekh liya hai, prep ladder," and they feel that okay, after watching them, you get a rank and you take up surgery. And it's very unfortunate that now the junior residents which we are getting, they are not very well trained in these small little procedures. So that is one very important thought. So one thing which I think should be a message to everyone is that before taking up surgery, if you have some time right now, before that counseling period starts, or even if before, now that counseling is starting, but still if you can spend a day or two with a surgeon, or maybe in a busy emergency or trauma ER, and just see what all is going on, because you really need to enjoy that sense of procedure feeling. Like, okay, you're doing something, you're suturing, you're putting a rice, Foley's, because that is all what you'll have to do as a surgeon. That'll be the majority part of your life. So I think that is very important.
And I also recommend any NEET aspirant who really wants to do surgery, you can watch a video called Tube Surgical Skills. That's a basic YouTube video. You should have your skin set, you should have your own instruments, practice suturing at home, and only then you join residency. Definitely not knowing that and joining is, not at all acceptable.
So, would there be any advice from your end as to why you should not take surgery? Like, is there anything which makes you feel you should not take surgery? Because this is not the branch for you.
So if you're lazy, definitely don't take surgery. We don't want lazy people in this department. You have to be, you need to really work hard, and you have to be disciplined. Surgery is mainly a gurukul. So in medicine, maybe you're not dependent on your seniors. You can just read Harrison's, watch your videos, and you can treat also to some extent. But surgery is not that way. Even if you study, empty number of books, you can't do a surgery. There should be a senior person who holds your hand. He needs to teach you every skill. For example, I still remember when I did my first laparoscopic cholecystectomy. My consultant, he used to point the monitor. Every step he used to teach me, every step. Maybe by watching a video, we may think it is very easy, but only while doing, you'll know that the small nuances you'll be knowing. So those kind of teaching is very important. And that's why, if you see in all surgical specialty, there is some kind of toxicity, because you are totally dependent on your seniors. You can't be independent.
Yes, sir. So I think,
but taking it in the right attitude is important. Rather than blaming your seniors, taking it in the right approach. Giving them respect. Definitely, you can do very good surgery. And even if you see, cutting chances is not same for everyone. It's different for different people. And only if you join surgery, you'll know that.
Yes. So I think, sir, this is the line which almost everyone tells us the day we join residency is actually your parents, your mother and your father in the department is your immediate senior, because he'll be most curious, or he'll be the person who will teach you most, because at the end, if he'll not teach you, he'll not be able to go ahead in the ladder. He'll not learn the newer surgeries, because once he teaches you the basic ones, he'll be able to learn the newer ones. So it's very important to maintain a good relation with your seniors, with your consultants. It's a very interdependent branch. And sir rightly said, I feel I'm not, I would say I'm not glamorizing this whole thing about no sleep or a lot of work and toxicity and everything. But then I feel surgery is something which demands for it. Like
Very true.
at times you will have to compromise your sleep, you'll have to work for long hours, because, and believe me, you'll not feel tired after working it if you're enjoying the procedure, if you're enjoying the process. So if there's a long OT which going on, say it starts midnight 12 and goes on till early 6, you'll not feel sleepy, because you're enjoying that whole OT and the atmosphere. Because in the OT, you'll not know that it's evening, it's night. In the OT, you'll be in the OT. And I feel, so the OT is the place where it's actually a meditation for me, where I'm away from all the disturbances, all the sound surrounding, and I'm just focused on the OT. That's it. I feel it's the best meditation. What do you think about
Yeah,
it,
very
sir?
true. Very true, Ayush. So I have seen few surgeons, even after post duty day, it will be post duty day, maybe at night 8 o'clock or 9 o'clock, and some people they just go to another OT just to learn surgery. So those kind of inspiration you need, and only if you have that kind, you become a better surgeon.
Correct, sir. So I'll just take this ahead with the third theme of this talk. So this will be okay. Do you have a question, Ipshita? She raised. Okay, so fine. We'll go ahead with the theme, sir, and then we'll take all the questions from all the people who have joined in. So the next theme would be residency life. So before we go ahead, I would just like you to tell us about how your residency life has been now that you have completed all the 3 years, and then I'd like to share mine, and then we'll take up the small bits and pieces about residency life.
Yeah. So generally, you can't expect cutting chances during your first year. I mean, that's true in many colleges. First 6 months, many places, 6 months, you're not even allowed inside the OT. My first year was very busy. So I think I joined in the year 2020. For 2 years, I didn't have my first year. So for 2 years, I was the first year in my batch. But the advantages, I learned how to do the ward work very fast. And when I joined, I didn't even have my co-PG. So I did, my first month was 15 duties per month. So basically, I used to come in the morning 8 o'clock, and next day night 12 o'clock I used to go. Again morning 7 o'clock, 8 o'clock I used to come. 7 o'clock, 6. I mean, actually 6:30 I used to come in the morning. Next day night 11 or 12 I used to go. So this was a routine for me. But you just get used to it. When you love surgery, you just go through this phase. And by the time I got my junior, definitely my cutting chances increased, and that's why you really enjoy surgery. And final year was definitely fun, where I did a lot of advanced cases, like we did DEP, DAPPs, thyroid, breast. I mean, all those cases we did. So that's definitely a fun time. Yeah.
So I think, sir, this is very important that all the aspirants realize that surgery is not just about the first year and the second. It's not just about the first year, because I feel everyone around takes advices from the just immediate first years who are extremely frustrated. Even I was frustrated in my first year, because I was told that take the patients for CTs, MRIs, be with the patients full day, just keep answering the queries, and then realizing that, okay, I'm not getting any chances. But now, when I've entered my second year, or the second part of the first year, when we get juniors in AIMS, so then we actually started getting opportunities to cut and the opportunities to operate, and that really makes for whatever we lost. But I feel, sir, which my consultant, my head of the department always says, that surgery is not just operative. So it is very true that it has three parts. It is pre-operative, operative, and post-operative. And it is the first year where you learn the pre-operative, and the first year knows the maximum about the patient. So if you don't prepare the patient properly, the operative is going to fail. And then again, the first year looks on the post-operative part, where the GR1 has to be awake the entire night after the post-op day 0, and take care of the patients, update about the vitals on the group. So Whipples, I remember one Whipples was operated, and I was awake the entire night sending vitals every hour. It was not just me who was awake; even my consultant was awake the entire night, even the pre-op as well as the post-op, trying to understand as to if anything goes wrong immediately. So these three things are very important for anyone to realize, that surgery is not just about operative.
Definitely.
So, sir, my next question would be, did you face any toxicity, or what do you define toxicity? Because everyone says surgery is toxic. So how do you define toxicity, and did you face any?
So if you're not in a toxic department, that means your caseload is very less, I tell. So only if there is caseloads, only if there are more number of cases, there will be some kind of toxicity. You can expect. See, expecting your juniors to do our work, I mean, that shouldn't be called as toxicity, but definitely it will be tiring. It will be hard. As you told, the first year actually is responsible for everything because seeing the electrolytes, if he doesn't see the electrolyte, the patient can collapse anytime. Especially difficult cases, you need to monitor all the vitals. So small things. I mean, first year can really save lives, and that responsibility. He needs to know that he has that much responsibility. It should not be done just for the naam ke vas. He should not do it, and he needs to be really, really disciplined and then do it, and only then he can see results. As you told, first year plays a lot of role, major role, and even even a successful consultant, if you see in Gangaram, it's a trust. So a lot of private patients also do come. So I've seen most of the successful surgeons who take proper rounds of the patients. So those are things very essential.
So I'll just give an example of one of the rounds which was taking place. So there was this patient with Whipples, and in the rounds, the consultant asked me, what is the serum amylase value? So I didn't realize it then. Why is he insisting on asking the amylase value in the preoperative period? So I just said, sir, it's normal. And sir is like, what do you mean by normal? What is the value? And I didn't know it. My SR immediately took the file and he hid it. And then he took the file of all the patients in the cubicle. And then sir was so furious at me that I didn't know the exact numbers and electrolytes and LFT and KFT of all the patients. But now I realize that how important was to know the amylase value, because if the amylase is not right, you cannot go ahead with the Whipples, because the anastomosis would fail. And then subsequently, I realized the importance of knowing A to Z about every patient, because they are relying on us. If we report a wrong value, if I would have that time said, okay, sir, it's 3.3, and tomorrow it turned out to be 2.8 and the anastomosis had failed, and the patient maybe had died due to a PJ leak, a pancreatic or jejunostomy leak, or whatever be the reason, I'd have to be blamed. But I'm also the JR1 who actually takes up the the responsibilities that, okay, I'll manage this patient. And once you start gaining the trust of your seniors, your senior residents, your consultants, they'll then start giving you chances in the OR as well, because they actually look that how are you managing the patients. If you're not competent in that, why would they at all give you chances in the OR?
And very important thing is, never lie to your seniors. If you don't know, tell that you don't know. That is more important, because if you don't know, at least they will look at the file, but don't give wrong information about the patients. That is very essential.
So we'll just take this one question from Raghav, that how to build a good rapport with the co-PGs, seniors and juniors from the beginning, or like, do we seek a mentor if we get a PG in a new place? So do you can you just brief on that?
I mean, definitely seek a good mentor, and as much as possible, never say no. Whatever help they ask, always be a yes person. Do all the things what your seniors tell, and definitely you'll be in the good books. Once you start avoiding work, I've seen a lot of juniors, they try to avoid work. Don't be that person.
And I feel, sir, even right now that I'm a second year senior, I'm not toxic to my juniors, but I want them to do the work. If I'm asking them to say collect the data for my thesis and they say, okay, no, or I lose the trust on them. So tomorrow, even when I'm supposed to hand over a case to them, that you go ahead, do the hydrocele, do the version independently, how will I be able to trust him for that? So you really build that rapport. And it's not about I would say respecting blindly. Obviously, at times you might find some seniors who are unnecessarily poking you. There have been some seniors, sir, but there'll be very few. There'll be many seniors who would actually want to teach you. In that teaching, it might happen that at times they shout on you. They are a little toxic, what people say, but toxicity in terms of work, I feel, is justified. But definitely toxicity, like say you're not allowed to use the lift, or you have to stand always, I feel that should not be encouraged.
Yeah,
What do you think?
Definitely. I've worked in the department, and toxicity, I won't call it as toxicity. They expect discipline. They expect the work to be done. And if that is done, I mean, they asked me to do a lot of extra work. Like I used to do other video editing. I mean, that basically molded me rather than I would never call it as a toxic thing. Yeah. And I think Naushad, he also has a doubt. Don't Naushad? He raised a hand.
Right. Noshid, you can either text in your doubt, or we'll just take the doubt after the themes.
Yeah, definitely. Later you can ask.
So the next theme which I would like to discuss would be very important is cutting versus academics, because I feel the only question which I keep on getting from everyone is, sir, do central institutes give enough cutting? Are there enough cutting opportunities? Nahi, sir, AIMS is not good. I've heard they don't give cutting. This cutting craze is crazy, sir. I want cutting. Surgery means cutting. So what do you think about it?
See, cutting is definitely an addiction. As you told, the adrenaline rush, definitely it is there in cutting. So people do ask about cutting. And no doubt, we always enjoy cutting. So that we can't deny. But what to expect from residency, there are other lot of things. For example, I've never seen a good junior who's asking proper questions like about academics, about research, and what are the other research opportunities present, whether any war drones are there. So those kind of questions, whether there are rotations, I mean, that is also very essential. Do you have rotations in different super specialty department? And all those who are all NEET aspirants, this 3 years is a very small period. You learn surgery throughout your life. So this is a very small period. And other things like, for example, journal club discussion, research discussion, how do you interpret research? So those kind of things, I mean, I rarely see any junior asking me about those kind of questions.
Because I think, sir, this whole this idea about cutting, it has percolated down to the juniors, but they only realize it once they join the residency. So even before joining, say, even I was thinking ki nahi, I should go to a college where there's more cutting. But after joining AIMS, I realized that surgery is a lot more about just cutting. Before cutting, you should know what are you going to cut, and very importantly, when you should not cut. That when you should not cut only comes after ward rounds, solid ward rounds, journal club discussions, research papers, publications, conferences, and you need time for all of this. You need to build yourself, your resume, because again, as you rightly said, 3 years is nothing. So I feel surprised at times when, say, in a particular day in an OT, so there's a Whipples which is posted, there's a laparoscopic E-tip, and say then there is a inguinal hernia open. So my consultant, say, would be learning something like a laparoscopic E-tip. My senior resident would be learning the Whipples, and I would be learning the open inguinal hernia. So everyone is learning on the same day. The learning never ends in a surgery. So this 3 years is very minuscule compared to what the journey is there for you. So even if you learn a little less cutting, you should not worry about it. And so very importantly, this whole thing about general surgery is not just general surgery. And I'm so glad I'm getting to have rotations in all the super specialties at AIMS, because that is important. Because as a general surgeon, if you're practicing somewhere, people won't just come to you only for a hydrocele and a hernia. They would even come for a BCC or an SCC. They would come for a cleft lip, cleft palate. They would come for burns. They would come for trauma-related doubts. They would come for something like a neurosurgery, EDH, SDH. So you should know how to manage that as well. And I think that might be the reason why now NEET SS paper is also based just on general surgery, except the super specialty which was there previously, sir.
Yeah, very true, very true.
And so, what things did you enjoy at Gangaram regarding conferences, seminars, etc.? Because people should know about it as well.
Okay, for me, first year was very busy. I never attended. I wanted to attend a lot of conferences, but I couldn't. It was very busy. I mean, it's quite understandable. We didn't have any. I didn't have any seniors. I didn't have any juniors also for the 2 years period. Then after I got my juniors, I attended a lot of conferences. I loved presenting. Ayush and I, we met in conference, Deep Impact conference. We attended quizzes. So this, it gives a lot of exposure. You meet more people, and surgery is also about building a lot of contacts. If you don't have contacts, you're not going to get patients. So that is also essential. I mean, maybe if you're working in a government institute, maybe it does not matter. But in being in a private institute, having good contacts, communication is also very essential. How you communicate. These are the things, even during residency, you need to learn from your consultants how they talk to a patient, how they convince them for surgery. So those aspects is also essential. Yeah.
So I will just tell all the viewers. So in the first 6 months, even at AIMS, I was not able to go for any conference. But as soon as my 6 months ended and I had my juniors, I was all ready to go and jump into this hernia conference in Delhi. And I was so amazed to see all the big consultants, big names, people who have actually, invented the Liechtenstein method and their disciples, and big names in the hernia society, in the abdominal wall, even in the GI, someone like Dr. Adarsh Chaudhary sir, Ramana sir. And I was so amazed and glad to meet them, communicate with them, present papers, participate in a quiz. And that has led me to build up contacts who have now been sharing about newer conferences on the same WhatsApp group. And now I've applied to them with my abstracts. And so even to apply to a conference, you need good papers and abstracts and case reports. So consultant won't be like, "Haan, jao, just go and enjoy." For being allowed to go to a conference, you should be able to present something. And if you have a decent, even a good case report for a conference, they are more than happy and willing to accept TGs. So you should definitely go for them, apply them, and you only get these chances when you get a little bit time free, when you have good juniors. So that is all a good, I would say, a family relation, because your juniors would take away that work stress from you and you'll be able to enjoy those conferences. And then the juniors would, in their second year, go to those conferences. So in that sense, also, we enjoy the work-life balance, which I was going to talk about next. Because through these, we get that work-life balance, which people think is not there in general surgery. So what do you say about work-life balance as a surgeon, sir?
I mean, my basic thing is that you can't expect a good work-life balance. It's more about work, and you enjoy your work.
Yes,
I mean, that's my opinion. And one more thing, I'm very proud being in Gangaram Hospital. The advantage was they encouraged doing research. So we had, for everyone, the research is compulsory. Passing MS or DNB, but most of the places, they don't do proper research. But the kind of importance the institute gave for research, it was fascinating. We had regular protocol meetings. From the HODs, they all used to sit with us. They used to discuss how we can improve in research. I have my juniors here. We have Tanushi. I think they will all accept the fact. Every person in the department, they'll sit with you, and they will decide like how better we can do the thesis, how we can improvise upon the protocol. So those kind of things, I saw it as a big advantage being in Gangaram.
Very true, sir. Even very recently, we had a research committee meeting where all the consultants would just, start questioning each other, because they want the thesis of foolproof. So I think if as Raghav said, in a tier 2, tier 3 city, if you are taking up general surgery, how you are going to be away from this FOMO. So I think everything right now is available on the internet as well. So if you are keen on research, if you are keen on good presentations and papers and case reports, everything is available on the internet, on the WhatsApp groups. Good, you can connect with good people and learn from them as well. So we'll just move to the second last theme of the session
just
today.
Before that, I'll just add one point. Many people, they tell that AI is not going to influence surgery, artificial intelligence, but it is going to change in a drastic manner, AI. So I think Aayush knows my brother. My brother is Dr. Vinayak. He has started a company called Curium, where they have AI and surgery. They have a company. So maybe definitely the surgeon's advantages will be doing the surgery. We can't expect in the near future that a robo will completely perform the surgery.
Theme which I would like to go ahead with is college selection.
Close to your hometown, or whether you want to go, then you have to look for the bond. So if you're planning to do an MCH, and if you don't want to have any bond, then better to take an institute which does not have any bond. And then you can continue, Aayush.
So the questions would be, number one is MS versus DNB. So that you have done DNB in Gangaram, and I know it's one of the most premier institute. So do you think DNB provides you with less opportunities, or are people looking DNB as inferior? What were your thoughts while taking up DNB? Because I'm very
I
sure you
had this
must
doubt.
be getting
So,
MS.
being in South India, we have this comparison DNB and MS. Definitely, they always see MS as superior, MS superior to DNB. I had this doubt, and I was getting a decent rank. I mean, I could have got MS or DNB, but definitely, I saw the advantages. First, I didn't have any bond. The stipend was much better, and the kind of opportunities. For example, the latest advances. Even now, I know the Premier Institute in Chennai for hernia, they do only mesh repair. I mean, most of the institutes they do just an only, but that's not the truth. If you come to a private practice, no one wants to. No patient would love to have an only repair. So uh, I mean, if you see the latest advances, I mean, I'm exposed to a lot of robotic surgeries. I mean, that kind of opportunities. Then I thought Gangaram is better. So you need to see the pros and cons of the institute. You need to compare. It's just don't take it as MS or DNB, but see the institute as an institute and whether will you grow in that institute. That's more important.
Very rightly pointed, sir, because what we tend to get influenced is that, okay, I'm happy to take MS in a very periphery college where they might not have the good advancements, because I feel surgery is a lot about advancements and technology. You need to have good laparoscopic instruments, you need to have good advancements, AI, robotics, because people are going for it. Like, gone are the days when people would just do an onlay or just an opening vinyl mesh hernioplasty or Liechtenstein. People are now going ahead with laparoscopic hernia surgeries. They even the laparotomies which have been being done by open laparotomies. Even today, as they were discussing, they would have gone like a laparoscopy and then proceeded even for an obstruction or a
Yeah,
perforation or a appendicitis. Like perforated appendix, people are managing by laparoscopic techniques, and
we
no
did
one wants.
recently. We did a Graham's patch in laparoscopy.
Okay, so see, Graham's patch in laparoscopy is only possible in a good institute like Gangaram because you need that expertise, because you have those instruments as well. So definitely weigh your institute versus institute rather than MS versus DNB. And so even in this, while you're taking MS, because DNB has no bond. So in MS you have 1 year, 2 year, 3 year bond. So what do you think about the bond?
Bond. I mean, if 1 or 2 years, it's fine. Not beyond 2 years. Definitely, I would try to avoid it. Beyond 2 years is definitely not worth it.
So I also think so 1 year is fine, because at the end you would want to do an SR-ship at the same place where you have graduated from, maybe because you know the department well, and as being an SR you really get a lot of opportunities because you are like a primary operating surgeon, even the ERs in the electives. So definitely I feel 1 year bond is fine. No bond is definitely great, but a 1 year bond, because it allows you to go for avenues anywhere in the country. But even a 1 year bond is good enough. 2 year bond, it's a little dicey, but 3 years is a strict no. I feel even a lot of people do it from Bengal because Bengal provides great hands, but definitely comes with a 3 year bond. So that was also a reason even why I left Bengal for
3
surgery.
years is too much.
Too much. If you are ready to pay for that bond fees and all, you have to be ready from today itself. Like, you have to make up your mind that, okay, I'm taking this, but I'm keeping 20 lakhs or 30 lakhs aside because I'll pay the bond fee, because no one wants to continue like 3 years, then 3 years, then do MCH. I have my seniors here who are doing MCH in surgical long gastro, who are from Mumbai, who are from Bengal. They have paid their bonds off because it's just like a baggage. You don't want to be an MCH and then go back to the same place and work as an MS general surgeon. You'd want
And
to always
sometimes they don't even treat you as a general surgeon. They make you a physician and they
This
do it.
this is the same in Bihar, sir. Because in Bihar they post you to district hospitals where you have to see, you have to even deliver babies. So everything which you learn in 3 years you tend to forget. And I feel, sir, right now in neurosurgery, I feel like I'm forgetting the general surgery skills because I don't get to operate hernias and anything. So I don't know how it would feel if you're not operating for 1 year straight after, say, your residency. That all thing you have to take care about. So next question would be 3 years versus 6 years, because a lot of 6 years courses are coming up. So what
Yeah.
are your views on that?
So coming to 6 year courses, I mean, we have it in CTVS, neurosurgery, plastic surgery, and pediatric surgery. I mean, these are the four which I commonly see. Definitely CTVS and neurosurgery. If you're really interested, you can take it. You have to you need to completely decide that, okay, I'll be taking only this course and only then you join, because the attrition rate in a 6 year course is pretty high because they don't know what to expect. It is a super specialty. We are too young to decide that whether we can join it or not. But if you're exposed to that field, if you're exposed to neurosurgery in your MBBS, and when you have decided that you want to take, then CTVS or neurosurgery is completely fine. But other fields like pediatric and plastic surgery, I would definitely recommend that you do a general surgery and then you go to those fields. It's easier to get plastic surgery and even pediatric surgery in NEET SS. You can easily clear it off. You can get in a better institute too. So, and when you have a basic general surgical skills, then the approach is much better. And regarding CTVS and neurosurgery, they're a little bit different from general surgery. The kind of operating, the kind of approach is different. So for those fields, if you're completely ready, then CTVS and neurosurgery is a very good option to take a 6-year course.
But I think so. It's more like a gamble. As you rightly said, if you're not very sure about the field, it actually proves like a gamble, is what I feel. Because right now, all the MCH neurosurgeons who are there in my institute, they are very good with their general surgery skills as well. And it applies to all the departments. Because I feel no one in CTVS is going to teach you how to close the skin. And the skin closes when you learn when you're closing the abdomen after laparotomy. Because you get very weird abdomen incisions, because in the emergency or in a damage control surgery, the primary operating surgeon is not really worried as to kaisa lagega baad mein. He just gives an incision and just opens it very quick. But then it's up to you how you aesthetically close the scar, close the wound. And that you only learn like a general surgeon. And in India particularly, so I feel is being a general surgeon first gives you a lot of advantages than being, say, a CTVS or a neurosurgeon right away. But still, definitely, CTVS and neurosurgery are a little bit very different from core general surgery. So if you're very sure, you can take them. But 6 years, plastics, peds, even right now, they introduced gastrosurgery names, Patna, 6 years, is what I feel like. It's you learn gastrosurgery
is not a good
years
option.
of yes as well. Like even today, my unit operated general Whipples, and Whipples they are operating in gastrosurgery as well. But if you have a good ladder, you learn your general surgery skills first, then go to gastrosurgery. It's much better, is what I feel. So.
Very true.
So we'll just like to conclude the session, sir. Regarding these future prospects, as Raghav rightly said, he's sort of guessing all the themes, I feel. So post MS, what are the opportunities which you feel you have right now? What are the super specialities which are there? And how do you see, like, what is your journey going to be now that you have completed your 3 years?
First, you need to decide where you want to settle, whether in a Tier 1 city, Tier 2 city, or Tier 3 city. And depending on that, if you are planning to settle in a Tier 1 city, super specialty is becoming a very necessary thing. If you see Medanta Hospital, they have only a gastrosurgery department. They don't even have a general surgery department. So the future in Tier 1 cities is mainly about super specialties. Moving to Tier 2 and Tier 3, we can survive with general surgery. Good general surgeons are needed, still needed. You need to, proctology cases like hemorrhoids, fistula, and even hernia is dominated by general surgeons. And also minimally invasive surgeries, it is also dominated by general surgeons.
So, like the super specialties which general surgery offers, post general surgery are namely, say, surgical onco, plastic surgery, urosurgery, gastrosurgery, CTVS surgery. Then you have trauma surgery, which is coming up as a very new field. You have minimal access surgeries. You have neurosurgeries. So there are many avenues to explore beyond MS. And in terms of, sir, this question we'll take up as a DNB or as an MS. Is it different?
In this, I'll just clear one thing. My simple funda is whatever you are passionate about, do that. You'll definitely succeed.
Correct.
It's not about, you can't see money in surgery. And if you're seeing money in surgery, then you're failing the first step. And if you want to put that much effort, like what it needs, any surgical field, you need to put so much of effort. You need to be really passionate about it. And same for super specialty. If you're passionate about that field, definitely you will be successful. There is no doubt about that.
And I'm seeing my senior residents SR1, working harder than what I've worked as a JR1. And I feel so bad about them at times. Why do they have to work again? But I think they're so enthusiastic about it, because now it's more super. It's not like a super specialty, but like more going towards exactly what you want to do as a surgeon. So no matter how tired they are, they're enjoying it like anything. They're putting EDH, SDS, they're putting VP shunts right in the night, like 2 a.m., 3 a.m. Then again going to the elective next next day doing cranioplasties, doing endoscopic guided surgeries, doing neuronavigation surgeries, and they're enjoying it because I feel they are loving that field. So once you're taking up your MCH, it's more like, okay, this is everything for me, and I'm going to pursue this for my entire life. And in that sense, I feel, sir, there's no difference between whether you have done DNB or general surgery as far as you qualify those exams.
Very true. And even in private practice, people don't see degrees.
Yes.
If you're a successful surgeon, if you operate well, if your patient goes fine, definitely you'll be getting patients. I know a lot of successful surgeons, even in Gangaram and a lot of private hospitals. Many are DNB and they do quite well.
So we'll take up this question by Suva that does the institute or degree matter in the long run?
Institute or the degree? Definitely the institute matters.
He has written both, but I feel like
institute, definitely the institute. I mean, degree, MS, DME doesn't matter. There definitely the institute matters. I mean, when you think that you have a right kind of learning opportunity, as I told, it's just not about cutting chances. See the in whole everything, whether it's good or not, like academics, research opportunities, and whether people will encourage you, and all those things. Once you see that, just go for the institute and not for the MS or DNB.
Kartika asked that can you address if there's a gender bias for female as to take
No,
general
not
surgery?
at all.
So
Definitely not. Okay, I'll introduce my wife. She's also a general surgeon, Dr. G.S. Divya. She's here. She's a breast surgery. She's a breast surgeon. Sorry, she's a breast surgeon. She's doing very well. I mean, there are a lot of successful female surgeons. I mean, even GI. In my Gangaram, we have a lot of GI surgeons who are females. My junior Tanushri, she is also female. They enjoy surgery, and there is no bias as such. We treat them equal. I mean, male, female, they are equal. Even while scolding, we scold them equally. Even while praising them, we praise equally.
Sir, out of the 5 juniors I have right now, just joined very recently from the July session of I9, 4 of them are female. So there's no gender bias at all now. Like, I don't say gender bias at all.
We just want hardworking people. It doesn't matter male or female.
Yes, sir. And so what do you think are scopes as a surgeon? Because I think everyone knows about it, but still I would like you to address it, that what all scopes do you have after a surgery, like after being a surgeon?
One, academics. You can become a teacher. You can teach in various institutes. That is one different field. Second, research. I mean, these are the things going away from the usual thing. Good research and publication. There are a lot of research opportunities. Even in India, when you do good research, you get a lot of funding from funding from those institutes. So those kind of opportunities you can look. I've seen my brother who has gone into artificial intelligence
startup and everything.
He has. That's a completely crazy new idea. I don't know how he started, but he's doing pretty well. He has made a name in the surgical specialty. So doing something different, something which you're passionate about, then you'll be doing really good.
So in the meanwhile, everyone can just put in their questions as well, and we'll just discuss further. So what I would like to highlight is something which I saw in the conference in the Deep Impact. The avenues which the technology is providing us with, like robotics. General surgery is not just about being a surgeon now. You have to be very well versed even with the technology, because robots are changing the future, changing the game of how surgeries are being performed. It's not just about general surgery, it's about they're leaping into everything. Surgical, long, gastro surgeries, and people are doing surgeries like never before, because it's reducing the workforce, it's reducing the time, it's improving the patient outcome. And they are employing surgeons as researchers for them. And you have surgeons coming up with new instruments. So unless you don't work in the OTs, you don't realize the problem areas, you'll not be able to explore and the newer fields and the scopes which has. So the question is, sir, that there's a lot of anxiety in the aspirants who have the mid or lower ranks, say around 12K or 16K. They're not getting good DNB and MS hospitals or institutes. So how should they go about choosing the institute objectively, which are not obviously a problem faced by aspirants with good ranks?
So at this juncture, when you got a rank of 12,000 or 15,000, just see whether this rank you got during an internship or after 1 year of preparation. If it is just internship, if you're prepared and just got it, then I'll always recommend you study for 1 year and get a good rank. But after 1 year of preparation, try to get any seat which see the specialty. If you like surgery, take surgery. If you like some other field, take that field, but don't try maximum not to compromise on the specialty. Then it's a long way to go. You can always learn. There will be a lot of good mentors. You can always get good mentors. Once, I mean, if you are inspired, if you are always ready to learn, you'll always be in the right place. So try to take the seat. I mean, don't try to postpone. Don't try to postpone for 2 or 3. Try to take the seat, and then you'll get the guidance.
So even right now, I feel if you feel that I'm done with all the studying part, 2 years or whatever, like if you have spent after your internship, and if you're getting a good a good MS college or a decent DNV college, I feel, sir, you can take it up because if you hone your skill yourself, and there are a lot of opportunities right now, so many avenues for fellowships, for learning under good surgeons, and coming back to your own city, then working more. So it might be like you will have to work a little more or harder than someone who has passed out from a good reputed institute. But if you're passionate about the same, you'll make your way.
And in at this I mean, in this modern time, it's very easy to learn also. There are a lot of YouTube videos, a lot of laparoscopic YouTube videos. You watch videos, you can definitely learn. So that is never, that'll never be a problem. Being any institute, you can always be successful.
Right. Ipshita, can we unmute Arjun Raja? I think he has a question.
Hello.
Yeah, hi
Yes,
Arjun.
Arjun.
Hi, Shyam.
Hi,
Can
hi,
you
how
hear
are you?
me? I'm good. I'm good. I'm actually Shyam's UG undergrad classmate here. I'm happy to share. I'm happy to see that Shyam is sharing his views and experience to the future aspirants here also. So I'm so glad. I'm just wanted to see you how you share your experience here. But as a friend and as a radiation oncologist myself, I closely work with a lot of surgical oncologists with me. And even the jargon within your surgery community is cutting. But I think the future is about organ preservation and reconstructing. So, and also, of course, I'm so glad that you guys touched upon the topic of research. So what do you think should be the mindset of this generation surgeons to go ahead with organ preservation and reconstructing quality of life and research?
Yeah, definitely organ preservation. I mean, a lot of reconstruction procedures in plastic surgeries, they're all highly developed. They are, I mean, a lot of research is going on. People, I mean, this should come from undergraduate. Problem in India is we don't emphasize in research from our undergraduate days. I mean, in other countries like Singapore or US, even undergraduates, they are supposed to do a research. So this is the first time people are exposed to research during post graduation. That's a little bit a sad thing. So people should know how to conduct a research, how to go through literatures, how to use even apps like Zotero or Mendeley. I mean, many people wouldn't have known also about these apps, but they should be an expert in these apps. They should know how to do this research publications, and definitely reconstructive procedures. For example, microscopic surgeries. They are the trend in general surgery. Like how we talk about robotic, there is another field of microscopic surgery which is advancing too. Yeah.
So,
Thank you.
so if anyone has more doubts, please. So yes, sir, can we discuss few of the good DNB and MS colleges? So
I mean,
we'll
that can't be done. I think. I mean, that is too much. I see. You need to have a good research. I mean, you talk to. I mean, whenever you call any college or any hospitals, when you talk to the residents, make sure you talk to a first year resident and a final year resident. Just don't, as Ayush told, don't just have your opinion just talking to a first year resident. So have a complete idea about the institute, and then you take the department. And definitely, there are a lot of other sites which would have given you the list of colleges and hospitals. Try to do your own research. Try to call each and every resident, do your own research, and then you choose the institute.
So I'll just a brief of what I used as a tool while selecting my college. So in like I made two columns. Number one was what I want from my college. So the major parts, which were like say academics, good cutting opportunities, but then something like a good environment, like the place where I live, a good mess. Even I feel these are important. Like you need to be healthy when you're working 24/7, and then nearer to the home, the stipend, what are the future prospects which the college might have. So like for me, no bond was the first priority. because for me I felt like I would like to go abroad for my research or fellowships, and that would only be possible if I have no bond, if I'm able to freely think from right now that okay, if I'm able to right now plan ki theek hai, after 3 years this is the places where I'm going to apply. So these were my list of things in priority order. And then when I was going and talking to any college, and I had a decent rank in NEET as well, so I would talk to all the colleges in Maharashtra, SMS, all the Delhi colleges, and there was always this fight between cutting versus academics versus stipend versus city versus everything else. Say in a college in Maharashtra or Mumbai had absolutely horrible staying facilities. They won't give you hostel. You'll have to stay in the ward. They have just a decent stipend, but they have really good cutting opportunities. They have good research. But some place in Delhi, they would not give you great hands, but they would have that no bond. They would have really good stipend. So it's very. I think it is the most tedious process. It is very. It gives a lot of anxiety while you're selecting a college, but you have to sort of tick and cross. Okay, this college is giving me no bond, so this goes up my priority. Similarly, whenever you go and speak to any resident, ask these questions. See, these are my preferences. I want these are my priorities while selecting a college, and then you talk to them and see if it aligns to your goals. Is
Yeah.
what I
So
feel.
it changes from each person's perspective. What a person wants, I mean, that is different. It can what I want can be different. What the other person what he wants different. And sometimes you can just choose the institution. You can't choose the units. And
Correct.
and if you always see in an institute, each unit is like totally different from another unit.
Correct. So
It's a
true.
totally different family. So at the end of the day, it's just a fate. I mean, wherever you go, it's a fate. Try to enjoy wherever you go. I mean, that's how you take it. If you take it in a positive aspect, then definitely you will learn more out of it. And as I told, this 3 years is a very small period. Definitely, you are going to learn a lot of things outside. Take it in a positive. Take it in a positive aspect. Then you'll definitely do much better.
So, like, honestly, the whole idea about becoming a surgeon should not be just, I would say, the money, the glamour, and everything, but the kick which you will get while operating. And to
Yeah,
be a good surgeon, to be able to operate good, you need to have that backing of research and academics, which I realized only after I got into an institute where they're giving equal importance to all of these. Had I been in an institute where it was only about cutting and no research, no academics, no conferences, then my what I'm talking right now would have been very different. Only later realizing that okay, I missed out on a lot of things. But there's no FOMO. Like if I'm missing it right now, I can build it up later. So as I said, you will learn either one of it. Either you learn a very good pre-op post-op, either you learn a very good operative, either you learn a very good post-op. You learn something in whichever institute you go. All you have to do is fill in the other vacant places in your
definitely.
training further.
For
And
example, I can give you in Gangaram Hospital, we have a lot of elective cases. We are being exposed to a lot of laparoscopy cases, but emergency cases is definitely less compared to any government institute, which I need to cope up. I know what are my pros and what are my disadvantages. After that, what I'll be planning, maybe I'll work in a government institute for some period of time. For the same, if someone who has worked in a government institute, he needs to go to a department where there's a lot of laparoscopy and robotic. So it's mixture of everything. So you make sure that you are complete by the time you finish it.
so Ipshita says that is general surgeons, like a lot of general surgeons are passing, so is the field getting saturated? And is there a compulsion to do super
See, every
specialty? What do
field
you
is
think?
saturated. If you take any field, it is saturated. So if you're just passionate about it, you have to go. I mean, if the way the trend, the lot of every seat is increasing. All the PG seats they are increasing. Just not surgery. So once you're passionate and you do well, definitely you'll succeed.
And I think so it's your skill which makes you apart, because the patients will somehow reach to you. They somehow reach our consultant saying he operated this and that person and they said good reviews, so he'll come and search you. They'll not search for what degrees you have, how many surgeries you have done, but the way you have operated the patient, how well you have behaved with the patient, how well you have explained him, how well you have followed him up. So all these are very important to be a good surgeon and not just operative as a whole. And so I also feel so saturation is one point, but if you are good with your skills, you can outshine anyone.
Yeah, you don't need to feel insecure at any point of time.
Yes, sir. So
And one
you,
more thing, when you told surgery is glamorous, I mean, that is where people get disappointed. During the first year, the main work is manual evacuation of feces. I mean, so people get really disappointed during first year. So, I mean, it becomes glamorous at one point of time, but definitely during the initial period, it will never be glamorous.
My senior resident had specially kept a case who has not passed feces for like 6 days, and he had done a PR, and he knew there was a lot of ecolith, and he called me that come, there's a very interesting case for you, and then he told me, okay, manually evacuate the stool. Like, very pissed off at that point of time, but then I realized, okay, this is also the fun of surgery. Like, because the next moment the patient is like, okay, now I'm relieved. So that is also gives a lot of kick, I feel. And so how do you I'll take this question by Ipshita, that how do you choose between surgical branches, say ENT, gynae ops, ortho, and surgery? Because there might be that, okay, I want to take up surgical branch, but I'm not sure with the branch.
So again, whether how busy you want your life to be, relatively ENT and Ofthal, little bit they are, I mean, not that hectic compared to general surgery. So try to decide whether you have interest. For me, I knew that I will never take Ofthal. Maybe little bit ENT was interesting to me. I knew I could never understand the physics of ophthalmology, so I knew that ophthalmology is not my field. So everyone will have that kind of thing, whether they are interested in it. Always value your passion rather than the scope.
And so OBG, I feel, is something very different from general surgery per se, because you actually need to enjoy that. I feel if you're confused, then go spend some days with a gynae in a gynae unit, OBG unit, and then you'll realize if you're able to fit in that. Because I was very sure that I'll not be taking it up. ENT was a confusion for me as well, but I think also, so this whole thought process that, okay, surgery nahi mila to ENT le lete, should not be there, because right now I'm seeing my neurosurgeons performing combined surgeries with ENT skull based surgeons. So every field has its own super specialty. So
Very
very
true.
recently, the mucormycosis which was operated, we had ophtha people coming in, we have ENT people, we have neurosurgery people, we have general surgery people who had done the primary debridement. The patient had traveled from neurosurgery, general surgery, ophtha, ENT. Everyone had collaborated together to operate on that case. So every department or discipline is also interdependent on each other. So there's nothing like ENT is good, ENT is
No,
bad, GS
and
is
that
good.
too, I see a lot of advanced surgeries in ENT for the even endoscope. A lot of endoscopic surgeries have been advanced in ENT. So every field is fascinating. I mean, every field is fascinating. You need to realize that, and then you take that field. And at the end of the day, whatever field you take, try to enjoy it. Don't crib upon that. That is important. See, any institute you take, you'll always think that I could have taken the other institute.
For
it,
sure. This
it is like
combo will never end.
it is like marriage. You choose your wife, you think, okay, the other girl is fine, better. I mean that. I mean, if every human mind sometimes thinks that way, but you have to come out of it. You have to accept the truth and be happy with whatever you have.
My first few months were horrible in the sense that I was always confused. Did I take the right decision? And I had ended up messaging almost everyone. Vinayak sir, Ramana sir, is this AIMS Patna fine, or should I go for grant? Should I go for KEM? Because I was getting them, I was like, always ki nahi nahi yaar, kya pata. I had even texted you, I feel, and it was also such a cumbersome thing. So anxiety was there, but right now I feel that whatever you choose, you sort of fit into it, and
True.
that's the best choice. So you have to accept it. Okay, now that I'm married, she's my wife. There's no divorce possible. So better happily accept it.
Very true. Very true.
So I think, so we can conclude the session. If anyone has more doubts, they can just quickly give a text on the in-call messages thing. And so glad, sir, you took time for the same. And hopefully, sir, we were able to guide some of our juniors. And if there's anyone is having any more queries, they can directly reach out to us, sir. So if you can share your email ID on the chat, it'll be great, sir.
Yes, I will do that.
Post MS, CSMLE, MRCS, some words in brief. So it's all possible. There's no restriction as to whether you can do or cannot do USMLE or MRCS. MRCS, almost all the aspirants, all the surgeons who want to add that MRCS degree or who want to go to UK for fellowships, they are giving it the MRCS. Even right now, I'm preparing for it. For regarding USMLE, again, if you are sure that if you really want to go to UK and do the fellowships there, then USMLE you have to do, I feel, because they give you the fellow of American College of Surgeons, and then you can go and work as fellows under good institutes. Say even say Liechtenstein Clinic, they offer fellowships. So what are your views, sir? Like USMLE and MRCS?
And
How
US
how
is a very good option for surgeons, especially. I mean, the pay is very good. If you see in AIMS Delhi, I've seen many people. They do. I mean, they go to US. They do USMLE post surgery, post MS or DNB, because they know that prospects are very good in US. The pay is very good. UK is similar to India. UK, that I mean, there are a lot of pros and cons. The work-life balance is very good in UK. But again, the taxation is very high, almost 50% taxation in UK. So those kind of I mean, you just need to see the pros and cons, and then you decide upon it. And even UK is a very long period. After you do surgery, then you go for ST1. It's almost an 8-year course you have to do in UK. So anyone who's interested, you can just message me. Actually, I can properly guide you for MSCS or USMLE. You can just message me. Can guide you. Yeah.
Sure. So I think, sir, we can conclude now. If you have any closing remarks for us, that will be great.
Closing remarks. I mean, I'm just happy to be in this place, inspiring young people to general surgery. I mean, general surgery has always been my passion, and inspiring other people to take surgery. I mean, I usually inspire. I mean, most of my interns in Gangaram Hospital, they end up doing surgery, and that's something really. That's something really rewarding to me.
It's actually great when you sort of keep on saying that, yeah, the general surgery, acha, I should take it and everything. So it's fun always to have your juniors who are interns come up and work under you. It's always a great idea.
So enjoy surgery. I mean, don't crib when you join it. You just it is like your wife. I mean, your life or a good girlfriend. You just enjoy doing that. Sometimes there will be good and bad phases. You just take it up and take it as a challenge, and then you can definitely cope up with it.
Sure. So, we'll also share the recorded session over our YouTube channel of South Asian Medical Students Association, and you can connect with us directly for any queries as such. Ikshita, if you're audible, if you want to close this session, that'll be great. Else, we'll call it.
Yes, but I'm sorry, but my microphone was not working, so I had to join in from another device. Thank you so much. This was very, very, personally, I loved this because I am myself trying to, I don't know, surgery is very interesting. And my experience of almost 2 months in the general surgery, I don't feel like coming out of there. So, that's great. So, thank you so much to both of you because
So
I'm
Ikshita is
sure.
going to become a surgeon.
I hope so.
Yeah.
I really hope so. So, thank you so much, sir. And thank you so much, Bhaiya, for taking out your time because I'm pretty sure that you both are very, very busy. So, thank you so much. And with this, I would love to wrap up the session. I would be putting this up on our YouTube channel for everybody who needs a reference. And thank you so much again to everybody who joined in and made this interesting with their questions. Good night.
Thank you. Bye-bye.
Bye-bye.
Thank you. Ikshita. Thank you everyone for joining. Thank you, Shyam, sir.
Thank
Good
you,
day.
Aayush.